Hello and welcome to our broadcast. I'm your host, Bethany Bick, Senior Digital Strategy Manager for the Providence Digital Innovation Group. As a reminder, the information provided during this event is for informational purposes only. For medical questions, please reach out to your primary care or healthcare provider. Let's get started. Joining me for today's live event will be Dr. Karen Boudreau, Senior Vice President of Enterprise Care Management and Coordination, and Sarah Vaesi, Chief Digital Strategy Officer with the Providence Digital Innovation Group. Welcome to both of you, and thank you so much for joining us. To get started, I'd love for each of you to tell us about your roles within Providence and how COVID has impacted the work that your teams do. Sarah, do you want to kick us off?
Absolutely. Thank you, Bethany, for hosting us today. And so I sit within the Digital Innovation Group, and we are a group of approximately 200 strategists, product developers, marketers, digital folks, and investors. And we work primarily on sort of that consumer-facing, patient-facing front end of the organization to enable it and make it patient and customer friendly, help folks find us, get the services that they need, help navigate individuals to the services that we need, and then engage them on an ongoing basis, which is a huge topic and certainly relevant for what we'll be talking about today as it relates to folks who have historically been relatively underserved by healthcare and healthcare systems. So, some of the work that we did during COVID, I'll hold that until after Karen introduces herself, just because it's, it was a collaboration across the entire organization. So I'll hold that for the moment.
Great. Well, thank you. And good morning, everyone. I'm Karen Boudreau. I'm a family physician by training, and I've been with Providence about 4.5 years. I sit in the Population Health Division under Dr. Rhonda Meadows. And my team, called Enterprise Care Management and Coordination, is really a very small but mighty team that uses our population level data, so understand the populations that we serve, and then to use that information to help us develop and improve programs that help patients in need, all the way from our frontline care managers in practices or in the hospital, all the way up to very large system-wide and regional initiatives like Medicaid improvement and health equity improvement. So we are quite an eclectic mix of data folks, technical folks, clinicians, and strategy thinkers that are really trying to make care more affordable and more equitable across all of our populations.
Great, thank you so much. I know across both of our teams, we share a lot of similar goals, but have different focuses in how we do that. So I'm really excited to talk about some of the work that we're doing together. And Sarah, you started to mention this a little bit, but the Digital Innovation Group has been able to play a big role in supporting Providence's response to COVID-19. Can you talk a little bit about some of those efforts?
Sure, and I'll keep it brief because we have talked about that to some extent on these live sessions, but we worked in collaboration with folks across the entire organization, our telehealth team, the population health team, the clinical program services, and in particular, the team that has been standing up our emergency operations command work around the response and mobilization of resources for COVID. So our IS organization. So everything I'm about to say really applies very broadly to the organization. And it was, as folks probably know out there, it's been all hands on deck. So I'll talk about the sort of the sliver and the part that digital innovation has played within that context, but it really is an enterprise-wide effort of which we are just one component. as I mentioned, in the introduction, we really focus on our patient or consumer-facing front end. And the first thing we did was to stand up an awareness hub that could be accessed by anybody across the across our communities. So we're in states all across the Western United States, from Alaska to Washington, Oregon, Montana, Texas, California, New Mexico. So we have a very broad geography that we cover, and everybody in those regions needs to know what's going on. And that was a huge part of it, was just awareness and information that's accurate. So we stood up an awareness hub and that had kind of timely information, as well as it was the home for an assessment bot. So we had the country's first chat bot that did frequently asked questions, as well as assessment of symptoms. And so it's like a very light clinical assessment, but really what it helped folks do was assess their risk and then move them forward to higher levels of care if they needed it. One of the places where it triaged folks to was something that that we've also worked on from a digital innovation standpoint, which is our on-demand video visit platform. So folks could talk with a nurse practitioner if they needed to. If the bot couldn't answer their questions and kind of meet their needs, they were able to get triaged to a nurse practitioner. If they needed a higher level of care, we worked very closely with our telehealth team, for instance, to stand up a home monitoring service that they could get triaged to after the video visit. And we also directed folks to live testing locations. So testing has been a tremendous, a huge issue throughout this entire crisis. And having accurate, timely information about testing locations and where they have capacity in particular was really an issue. So we had that testing, live testing locations. And then finally, kind of just managing all of the sort of supply and demand of what visits are available and how can folks access those. We optimized across that, in particular as some of our physical locations started to reopen with a platform that we call DexCare that we incubated internally. So this is really that end-to-end experience around I need information all the way through how do I get monitored at home and get the care that I need. And so that was a big part of what we did initially. And of course, it was it continues to evolve. We've been working with the CDC. We've been working with all the clinical teams around the guidelines and the protocols and everything. So it's not that it stopped once we developed it initially, but it's an ongoing effort. And with vaccines coming out, hopefully in the near future, that'll also have an impact on how we present information and present ourselves to our patients and our communities. So this will be something that you'll continue to see kind of evolving over time. And then later today, we'll talk a little bit about how we've specifically started to think about tuning that so that we can serve folks who have been historically underserved.
Thank you so much, Sarah. The access to accurate information and healthcare resources to get treatment for COVID, I know has been such an important part of Providence's response, especially from a digital standpoint. And Karen, I know your team has done a lot as well to support patients during this time, and also done a lot of work to understand the clinical, sociodemographic, and environmental variables that are associated with infection of COVID-19. I'd love for you to share a little bit about how you're supporting patients and really what your teams have learned through this as well.
Absolutely. Thank you so much, Bethany. And I think, dovetailing on what Sarah was saying, the availability of digital tools to assist people in making their own decisions, in understanding the information they need, in accessing care is critically important. And we've been very pleased to have the chance to work with the Digital Innovation Group on making sure that those platforms and those resources are as accessible to all as they can be. And you guys have done a fabulous job doing that. I think we've seen shifts in our use of telehealth, in our use of Express Care Virtual, to go more broadly across our populations, across payer groups, across economic groups, which we don't typically see. And so that's been very gratifying to see. And I think it's the first step in where we need to absolutely continue our efforts to make sure that resources are not just equally available, but equitably available, so that they are meeting the different needs of different populations. That gets more challenging when we start getting into other languages and other ways of accessing, where there may be technology deficits or bandwidth deficits or other technical issues that may make access more difficult. And so it's I think a very exciting frontier that we're working in. We did a study, as I mentioned earlier. The foundation of the work that my team does, our team does, is looking at population level data. And being an organization that spans 7 states, we have a lot of information at the population level of the patients that we care for. And so we started at the very beginning looking at trying to understand who was at risk for actually getting sick with COVID, because we had care managers who were making phone calls every day and needed to have an understanding of how might they triage patients, how might they advise patients based on their risk. And at the beginning, we didn't know a whole lot. So we started just using the factors that were coming out of China and other countries, coming out of the CDC. And then as we started to look at our own data, we were able to do a study that was able to get published to look at what are the factors associated with infection. So we looked at over 34,000 patients that were tested within our Providence system, and found, retrospectively, it's not surprising, but the factors that played the most significant role in whether a person is at risk for getting COVID to begin with really reflect sociodemographic factors, almost more so, certainly more so than healthcare factors themselves. And we've seen this across the country with the disproportionate impact of COVID on populations of color, particularly the Black and Latino population, as well as the Native American and Indigenous populations. So we were able to codify that, to understand what are those factors, and then be able to create an indication so that our care managers and physicians and others could understand whether a patient had a higher number of risk factors than others, and could help them, advise them in terms of, should they come in to be seen, or can they more safely be seen by telehealth? Should we be advising them on what they need to do to stay safe at home? And what's been most, I think, challenging is that the factors that play the most, that are so difficult to get around, are when people are living in dense housing, in particular, in either multi-generational families, or because of economic hardship, having more people in a small space than we would like to see with COVID. People who are not able to work from home, people who need to be out either in the fields or in the grocery stores or on the buses, or any activity that is an essential worker. Those folks are disproportionately impacted. And so that's where it gets a little harder to figure out how can we really help them mitigate circumstances that they may not actually be able to control. And that's what we've been spending a lot of time thinking about.
Thanks, Karen. Are there any either current or planned initiatives, as we even see such a rise in new COVID cases right now, that your teams are planning, or gaps that you're hoping to address in the future in terms of this, that you'd like to talk about as well?
Well, I think for me, one of the ones that is the most, in some ways, most surprising and yet still most challenging to deal with, is just making sure that people have the information they need. We are living in information saturation. COVID is all over the newspaper, all over the news, all over the web, all over Twitter, everywhere. But the people who most need the information often still don't really have the practical information. How do I isolate if I am in a two-bedroom home with 8 people? How do I actually keep us separate and safe? How do I go to work and be safe and reduce my chances of getting coronavirus? So I think really we need to have a combination of really sophisticated approaches and also really straightforward, clear information that will help people keep themselves safe. And the main things that we can do to keep ourselves safe are not fancy. Covering our faces, washing our hands, keeping distance from each other, not gathering with people outside of our immediate circumstances unless absolutely necessary. And those are the things that we just need to redouble our efforts. We've had some great initiatives in many of our regions where we've had caregivers going out into the community, either going out into the fields or going out to employers or going out to communities to share that information. We've had self-protection kits that have been shared. We've been, giving out masks, giving out hand sanitizer, giving out information, and mostly it's giving out the information that's really the most important piece.
Yeah, you raised such a good point in that we have so much, it can feel like we have so much access to information now just with all of the resources that are available on the internet, but that can often be so overwhelming because you don't necessarily know who to trust. And the news cycle moves so quickly sometimes that it's hard to take it all in without overwhelming yourself a lot of times. So that's a really great point, Karen. Thank you for sharing that. And Sarah, I know within the Digital Innovation Group, we have been working on some different projects to support some of the challenges that Karen has really highlighted. So I'm wondering if you'd like to talk a little bit about a few of the examples that we're working on within DIG.
Absolutely. And Bethany, of course, you've been leading our efforts within DIG, so I will be speaking on your behalf to some extent. And so chime in if I miss something. But first, I'll start by saying, what we're aiming to do within DIG is not a kind of one size fits all approach. It's meant to be personalized and reflective of the diversity of people and languages and cultures that are out there. And so, digital in general kind of drives and strives for personalization. And some of the work that we're doing right now is taking that into account with data sources that historically, like maybe we haven't had as much access to, like the ones that Karen described, that if you notice, almost none of them were clinical in nature, right? Like they're who do you live with, and where's your job, and those kinds of things that are extremely important as it relates to folks, their overall well-being and health. So, we're striving for personalization, and I use the chatbot as one example of our coronavirus response, kind of more generally. But as you know, Bethany, we, with the work that Karen and team did, they, with the folks that they identified as being at kind of a unique or elevated risk for potentially contracting COVID, or maybe not knowing what to do if they are at risk in some way, we developed through our summer hackathon, which is a very cool kind of way of doing product development very quickly. That was led by our product development team. We created a chatbot that was focused on, for multiple languages, providing folks with information about coronavirus, as well as testing through modalities that we may, typically not be that in tune with, or that we think, it's not just the coronavirus awareness hub, right? That requires really a computer and solid web access and all these things. But we created this chatbot that would be SMS or phone enabled, right? So folks, the vast majority, 99% of people have access to a phone. And most folks have access to SMS nowadays. And so, driving sort of dynamic translated information that's timely, accurate, from a trusted source to folks that we can proactively identify them because of the work that Karen and her team have done, and then delivering that information in the form of a chatbot that is in different modalities that are, don't require a lot of data bandwidth, which is an underappreciated sort of challenge as it relates to folks getting the information that they need. And then directing them to resources. And so there's, at Bethany, as you know, there's a lot of evidence out there that folks just may have, while we have a wealth of information out there, not all of it is reliable, not all of it is truthful, not all of it is practical and clear. And so that's what we aim to do with this chatbot. That's one very clear example. Another example is, of course, a lot of folks have experienced economic sort of changes in their life, right? A lot of job loss is a huge area. A huge problem. And for folks who've lost their jobs, their insurance status is likely going to be changing. And so we're doing quite a bit of work on digital financial counseling and sort of benefit enrollment for folks whose status has changed. And of course, that requires having an early warning system so we know who's lost their job and how can we proactively again reach out to them. So we're in the very early stages of that. As you know, Bethany, it's a very complex problem, and we've been working through it pretty diligently for almost a year now. I mean, since February certainly, and even before that, in contexts outside of COVID. But those are just a couple of the examples that we're really focused on.
Yeah, I think the interesting thing that just came up as you were describing some of the projects we're working on, Sarah, is really how proactive we have to be with something like COVID-19. I think in a lot of other situations, sometimes maybe we let the patients come to us first and, that are able to identify who they are and, provide the support to manage their health conditions and their care. But with something like COVID-19, it's really so important that, we're out in the community, like Karen talked about, and being proactive about providing that information and through multiple channels so that people who may have different options for how they access information have different options for that as well. Karen, would you say that's consistent with what your team has learned through this as well?
Oh, absolutely. And I'm so excited about the multilingual chatbot because I think getting started, I also see the potential for, really expanding. This is our first foray into that kind of interaction with folks, but it creates that relationship that now we can be seen as a trusted source, a trusted inclusive source of information that gets to me in a way that I can digest it. And so that gives us the opportunity then to continue to expand how we relate to folks in that way going forward. I think the point, Sarah, that you made about people's insurance changing and getting connected to new benefits and staying connected with us as a healthcare provider is really important because there's nothing more unsettling in a time of crisis than to think, oh my gosh, do I need to find a new doctor? Do I need to find a new healthcare system? What happens if I get sick? So being able to continue that continuous, using the word continue too much, but creating that continuous relationship that is a trusted one is so critically important. And I'm really excited about that.
Yeah, we are as well. Thanks, Karen. The last thing I wanted to circle back to was something that you mentioned a little bit earlier in our conversation, Karen, around health equity and how it's important that we not just provide equal access to some of this information and resources, but that we're really focused on equitable access. And I'd love for you to talk a little bit about maybe what that means and then what Providence's efforts and initiatives are in this area.
Absolutely. Thank you so much. When we talk about health equity, we try to stick to the World Health Organization's definition of that, which is really the achievement of the optimal level of health for all persons. And that in healthcare, we have a tendency to think about things in the 80-20 rule. How do we approach things so that we can do the best we can for the vast majority of people, which is really important to do. And there are times when thinking about people sort of all lumped together doesn't actually enable us to assist people and engage with people in a way that will help them achieve their optimal level of health. Oftentimes, the things that impede folks' ability to do that are outside of their control. Where they're able to live, the jobs that are available to them, the conditions of the community that they live in, the resources available to them are not necessarily things that they can control, and often are the results of decades and generations of inequities in our society, structural inequities, things that we as a society have chosen to perpetuate. And so a lot of our work is now beginning to just really uncover what are those factors, and how can we engage with people from different communities in an effort to overcome those inequities and overcome and reverse the structural underpinnings of those. And so Providence has made a huge commitment to addressing health equity, improving outcomes, and reducing inequities for the patients that we care for, the patients in our health plan, as well as in the communities that we serve. Over the next, we've initiated the work over the next 5 years. This is the work of a lifetime, truly. And it all starts with a willingness to look at our own data, to understand what the differences are, and to not shy away from those differences, to make sure that we are addressing them head on and in collaboration with the people that we serve. Because if we knew all the answers on how to fix these things, then we would have no excuse for not having done them already. The challenge is that the solutions are not as straightforward as we think, and really require us to work with, not work for, or not do to the communities that we serve. So I'm just thrilled to be doing that work.
Yeah, that's such a great point, that the collaboration with the communities is such an important part of that. And I truly hope that this is an area we can work ourselves out of a job of. That I know that it's a tall order, but I think that we can do it, and we can make progress in this area. Sarah, in terms of health equity, what role would you say that digital has to play in supporting that?
Well, I think I'll give one very specific example where I think digital has actually kind of contributed to what we and the industry kind of call a digital divide. The availability of telehealth, for instance, is a big area. Before the COVID crisis started, almost about 1% of our on-demand video visits through Express Care Virtual, the thing I mentioned to you, just a very small fraction, were for patients who had Medicaid as their insurance. And with a lot of the emergency use authorizations and some of the regulatory changes, we saw that number go up to peaking in some cases around 13 to 14%. Bethany, you know those numbers. And they stabilized. They came down a little bit, but they've stabilized. And that's without changing anything like broadband access, or it's just changing the regulatory and payment environment for those types of visits, right? But imagine that's 90% of the visits are going to other folks. And folks who really need it in our communities. I will say this, 10% of our patient population or our community population is not Medicaid insured. It's much higher than that. And so they're not able to access those technology-enabled services for a whole host of reasons. And so, but there's tremendous potential, right? For instance, if we take that telehealth example, it can really help folks who may have transportation challenges, who may have difficulty getting out of work during the day when there is when all the clinics are open, right? And not having to find their way to an emergency department, which is a huge inconvenience, and there are a lot of challenges with it. And so I think, there's the potential for it to democratize access, make it more affordable. Over the fullness of time, we would certainly hope that the ability to have digital enablement of, like, for instance, a video visit would actually bring the cost of care down. And so it makes it more accessible and more affordable to individuals. And so, those are the kinds of things. That's just one example of the potential. It has the potential to benefit folks who have some of the structural barriers to receiving care. And it just hasn't been fully tapped into it. I think partly because we sort of live in this like market-based economy where we follow the dollar, but fortunately, I think because this crisis has just shown all of us how many problems there are with our current system, that hopefully it's a motivator. Like we talked about, like the ability to dynamically translate language is so incredible and has so much potential for anybody, and all comers, on the spot, not like, oh, let me go find you a translator and 2 hours later, this thing happens. Like, so there's just tremendous potential. But I would say the first thing is we have to know our patient populations and our communities. And that's one of the big things that we're working on, is knowing who folks are, knowing what their needs are, knowing what their experiences have been with accessing healthcare, accessing technology, and just having that baseline understanding so that we can be inclusive in our product design, and really responsive to the needs of folks who historically have been sort of on the fringe in terms of how we've served them.
I couldn't agree more, and I know we're getting close to, if not over time, but I wanted to emphasize that to the nth degree, and also remind ourselves that looking at payer source is one way, and the payer source is often an impediment. Inequities go across all economic strata, the language issue, the cultural issues, the making the care inclusive and welcoming to all folks in that personalized way is so key, because there are definitely inequities in all of our populations that go across really many, many lines. And so it is exciting to be at the point now where we're ready to tackle that.
Yeah, absolutely. And I think you both hit on important points within the context around it's really about designing with our communities, not for them. And that's very applicable within the context of digital as well. So thank you both so much for joining us today and sharing your insights and expertise. I am very grateful to work with such smart and capable women, and I'm really proud of the work that you're each doing to both support the employees that you work for or work with during this time, as well as the communities and patients that we serve. So thank you for your work, and thank you to those who joined us for our broadcast today. To learn more about our programs, services, or ways to give, or if you're looking for medical care, you can visit providence.org. And for more information about the Digital Innovation Team, you can find us at providence-digitalinsights.org. And make sure to follow us on social media at Providence Health System for LinkedIn, Facebook, and Instagram, and Providence on Twitter. Thank you so much for joining us today.
Thanks, Bethany.
Thank you, Bethany.